You're listening to On the Couch with Dr. Michelle, right here on LA Talk Radio.
And welcome everybody, as you always are, to my couch here. We're talking about one of my favorite subjects, actually, today. It's about energy healing. And we're going to find out from an expert what you can do if you are an energy healer yourself, or are thinking about becoming one, or if you're interested in checking out energy healers for yourself, how these energy healers can protect themselves legally and ethically, and manage any kind of risk factors. So we're going to be learning about that, but we're also going to be talking about energy healing practices and some of them, what they're about, and some scenarios that have happened to people before. And I have a little story to tell as well about an energy healer that I knew and got herself, although she was certified and had years of education, she kind of got herself in trouble a little bit. So we can talk about that. I've been given authority to talk about that as well by her. Let's bring up my special guest today because we're going to be talking about her book. And here it is. All right. Midge Murphy is the author. It's called Practice Energy Healing in Integrity. Let me get that without the glare here, Midge. There we go. The joy of offering your gifts legally and ethically. So welcome to the show. Thank you so much for being here with me on the couch.
Well, thank you, Michelle, for having me. This is an honor, and I'm delighted to be here with you today.
Oh, thank you. And I really enjoyed your book a lot. It was just terrific. Let me tell folks a little bit about you. You are accomplished, amazingly so. You're an attorney. You have a PhD in energy healing. You're intelligent. You're lovely. You have gifts to give people. And we're going to be talking about your Practice Energy Healing in Integrity book today. Specifically, like I said, for those who are in energy practices, and also for people who maybe want to become energy healers and have always been fascinated in that and wanted to know how they could get better training or something. And also for people who are interested in the practices to get a little bit more information before they jump into going with an energy healer that might be interesting or maybe a little too good to be true in those senses. Let me introduce you a little bit here and let folks know more about your background. Now, you practiced entertainment law for years, over a decade, I understand. And you worked for ABC Network, also Paramount Pictures or Columbia Pictures, Century Fox, and Disney. And then you started to explore your own spirituality a little bit. What's that all about? And then you enrolled in Holos University. You became the first attorney, actually, in 2001 to earn a PhD degree in energy medicine. And you became an energy healer yourself. But I knew you practiced primarily on your law practice to help people out. Can you talk a little bit more about what you do to help energy healers and others know more about the practice?
Yeah, thank you for that introduction.
Sure.
I'm actually consider myself a bridge between two worlds.
Yeah. Okay.
The world of energy healing. I'm an energy healing practitioner myself, as well as my background in law and business is that I understand the regulatory issues, the legal issues.
Sure.
And so I become a bridge between those two worlds. And what I found is that with respect to the whole field of energy healing, there is just a lack of knowledge and information from the practitioner standpoint about what it is to have a legally sound and ethical practice.
Right.
There's a huge, big gap there. And I discovered that when I was finishing my PhD, I really didn't know exactly what I was going to do. And so I had an opportunity to teach an ethics course at an academy down in California that offers a 2-year training program. And I realized that there is this huge gap and there is a deep need for this information and this education and these resources to be available to energy healing practitioners and training organizations. So I no longer practice law. I want to be really clear about that.
All right.
What I am is a professional liability risk management consultant. And
Okay.
so I work with individual practitioners, both
Right.
licensed and non-licensed, who want to incorporate or use energy healing methods in their practices. And they
Mhm.
are very, very two distinct groups. Now, you're a licensed clinical psychologist,
Mhm.
so you have
Mhm.
a license to practice
Mhm.
psychology. But if
Right.
you wanted to bring in some unsubstantiated, new, emerging energy healing methods such as the Havening techniques or EFT
Mhm.
tapping, those
Mhm.
kinds of things have a great application in the therapeutic setting within a psychotherapy practice.
Yes.
However, if you looked at how the practice of psychotherapy is defined, those techniques would not be considered part of the standards of care because they're not
Right.
included
Right.
in the legal definition of what it
Exactly.
means to practice psychotherapy. So
Right,
the
right.
risk that licensed people face is they could be subject to professional discipline for practicing below the standards of care or outside their legally defined scope of practice.
Right,
So I work
right.
with licensed practitioners all over the country to
That's
help
great.
them
Hmm.
manage
Right.
how do they incorporate these methods safely and also protect their licenses at the same time. So those are kinds of
Right.
consulting services for someone like
That's
yourself.
wonderful.
And
Sure.
then for non-licensed practitioners, who I'm one of them, our biggest risk that we
Uh-huh.
face is being subject to practicing medicine or psychotherapy without a license.
Great.
Because
Sure.
just behind any kind of healing work,
Right.
the way the courts have
Hmm.
construed it, the way medical licensing practice acts are drafted and
Sure.
interpreted,
Sure.
just about any kind of healing that you do is considered the practice of medicine. So
Right.
that's a
Exactly.
significant risk that a lot of the people that are out there thinking, okay, I can go ahead and be an energy healing practitioner, are unaware of the significant risks they face. And it's a
Right.
crime. You're not going to be thrown in jail,
Right.
but you very
Yeah.
much could receive a cease and desist letter and they could close your
Sure.
practice down. So
Sure. Sure.
these are the kinds of services that I've offered for the last 17 years to practitioners across the country. And then I also work with training organizations.
Yeah.
And
Yeah.
for them, their biggest risk is they could be held legally liable for the actions of the students that they're training and certifying. So it behooves them. It's very important for them
Makes
to make sure,
sense.
yeah, that
Right.
their practitioners that they're training have had training in ethics and legal issues. First of all, it's a win for the
Right.
practitioner. They get the
Sure.
training they need. It
Sure.
protects the training organization from lawsuits against them. And so we have
Right.
what
Right.
I call a revenue sharing program. So there
Right.
are several
Right.
training programs, and we mentioned one earlier before we started our show that require their students going through their certification or training programs to read my book and take the exam based on the book. And
I
so
think that's terrific too.
that's
Yeah.
a certificate of completion. Sure, it's professional credential. It's something they can show that they have earned it, can show to their potential clients, yes, I've had this training. And the school gets a commission on every exam that one of their students purchases. So it's kind of a win-win, protects everybody. And for me, it's a path of service to get this information out
Sure.
there into the field. Yeah.
Sure, sure. No, it makes such good sense, and you are a pioneer in this as well. But you know law and ethics, and risk practice, information and all that. So I mean that's wonderful. And of course, you're an attorney. You don't practice fully as an attorney anymore, but I just love the business that you have, and it helps so many people. It'll help the patients slash clients or whatever.
Hmm.
And yeah, we were talking about havening just before we started, and I do practice that, and I have disclaimers and I have information that I give to patients before we even practice it about the theory and about the
Hmm.
self-comforting and about various types, because it's them healing themselves per se. So it's their own practices of, and so we have risk management
Hmm.
disclaimers in there and stuff like
Yeah.
that. So I mean,
Perfect.
it's a great idea. It really is. So I'd love to find out what it was that made you become more in touch with your spirituality before you started this, kind of business and became a healer yourself. So,
Yes. Well, first of all, I never call myself a healer
okay,
because for me, there's two aspects to that. One is an ethical aspect, and that is
sure.
the only healer in the room is the client. I'm a
Wow.
facilitator. I can witness, I
Yes.
can hold space, I can facilitate, but I am not a healer. And the other reason I never call myself a healer is because if I did, I could be subject to being charged with practicing medicine without a license. There's certain titles you really should not use. And so I never consider myself a healer. But going back to your question, which I really appreciate, is I was working at ABC
Hmm.
and motion pictures at the time, and I had accomplished everything I wanted to accomplish. I was a respected entertainment law attorney working
Yeah.
for ABC with a beautiful office in Century City. You would know about that, above the Schubert Theater, right? A-
Lovely, lovely office. How
And I
cool.
just, yeah, and I just remember Peggy
Yeah.
Lee's song coming into my head, Is This All There Is? Because I had accomplished everything.
Right.
And then I'm
Right.
going, but I still feel this little, there's something empty in there still. And the receptionist, who I'm still dear friends with all these years
Oh,
later,
yeah.
he mentioned a book called The Autobiography of a Yogi about
Oh, yes, I know that one.
Yogananda. Yeah.
Sure.
So I read his book and I
Yes.
just started to be more curious and exploring more
Lovely.
about the spiritual aspects. And there was a self-realization fellowship right there near my house in Santa Monica.
I'm
So
actually going there tomorrow.
I love it. I love it. So that's that's fast forward. And then I left practicing law, and I actually at that point in my life co-owned an adventure travel company with my then husband, and we
Interesting.
led
Uh-huh.
treks
Yeah.
all literally all over the world. So I spent a lot of time in Nepal, in Tibet,
Wow.
Pakistan, India, all where there's big high mountains. And so I
Oh,
was
that's
exposed to
great.
all of those cultures as well, especially
Sure.
Tibetan Buddhism and those kinds of things. So
Lovely.
again, more eye-opening, more about seeing different cultures and
Yes.
different spiritual practices. And then I decided I wanted to become a hospice volunteer at our local hospital
Lovely.
here.
Lovely.
So I
Wow.
did patient care for about 8 years, and that was a really eye-opening experience. And it was a huge, wonderful foundation for doing energy healing work because you have to be fully present,
Right.
non-judgmental, and compassionate because you're meeting
Ah,
people where they are in the
right.
process of transitioning out of their
Sure.
bodies.
Sure.
So as a result of that experience, I was given the opportunity to learn therapeutic touch, which came
Right.
out of the nurse profession. And I went to the class and I thought, well, this is interesting. I don't know anything about energy.
Sure.
And it was just there. I just felt it. I was like, wow, I see this energy. I can feel it. It's like it's so innate in my system. And so it really started to spark my interest in really working with my intuition. And this is a hands-on technique. It's like healing touch. There's Reiki,
Yeah.
there's other ones. And so I got initiated as a Reiki master. I've done a lot of
Oh,
shamanic work over the years. I've studied with Native American indigenous teachers for over 20 years. And I really resonate with a lot of that work that I do. And I'm also certified as a matrix energetics practitioner. So those techniques and methods are in my toolbox. But that means
mhm,
I can really relate to my clients and people who
mhm,
are doing these kinds of
mhm.
energy healing methods in that I
Yeah,
understand what they're doing. And then I can work with them to make sure that they're not inadvertently creating a legal problem for themselves by how they're describing their services, what kind of
sure,
title they're using.
sure,
All of
sure.
that goes hand in hand with making sure you have a legally sound and ethical practice.
Right. That's amazing. So, what can you describe a little bit about? Is it more touch healing that you learned how to practice, or matrix healing, or what? What was that
Well,
specifically? Or
all of them basically.
yeah,
I'm not
yeah.
trained in EFT tapping, but I've learned it and I use it on myself. But I think
Oh,
it's
okay.
important to think that energy medicine, energy healing, biofield practices are
Hmm.
really considered part of the field of complementary and alternative medicine.
Uh huh.
And
Yep.
we're really
Yep.
dealing with the subtle energies of the body.
Yep.
And so
Yeah.
what's important to understand, there's sort of different focuses. For instance,
Hmm.
tapping, meridian
Hmm.
tapping,
Hmm.
acupuncture, acupressure
Hmm.
would be considered a meridian-based practice.
Right.
So there's
Okay.
the meridian
Yeah.
system.
Right.
There's the chakra system. A lot of Eden energy medicine work deals a lot with the different chakras. There's a lot of muscle
Right.
testing. There's
Hmm.
also the biofield practices dealing with the entire biofield, and I would consider
Right.
therapeutic touch a biofield practice. So there's different ways to sort of describe and look at
Hmm.
what you're doing.
Hmm.
Um, but the bottom line is we're really working with the subtle energies of the body and not
Right.
the physical
Right.
body itself.
Exactly, the subtle energies, and somehow some of the ideas are that the biofield or whatever, it's a little off balance, or they're in the chakra sense, it's congested. You need to have, full, moving up to the crown chakra or whatever when we're clearing the body and that kind of thing. And of course, imagery as well. Imagery is incorporated, and that's a touchy subject too, and sometimes in psychology, because when we use hypnosis therapy or imagery therapy, that's considered, there is evidence-based information on that, the effectiveness of them. But still, people have to be very careful about the type of energy work they do on people, and to protect themselves legally as well.
Right. Yeah.
Because
exactly.
Are there a lot of businesses out there or people out there you feel who are not working ethically or legally that we can just have access to online?
The vast majority of people offer energy healing methods,
Okay.
in my opinion.
Okay.
Yes.
Wow.
Yes.
That's really interesting.
Yeah.
And there are, and it's so.
And they're not doing it on purpose.
No. Yeah.
They just don't know any better. They just haven't had the knowledge and education to make sure that they have legally sound and ethical practices.
Right. Do states individually require licenses or certificates, or is this something that really needs to be looked into?
Oh, that's a great question. So I like to step back just a little bit and give some framework for the listeners. And that is, as I mentioned, energy healing methods, biofield practices are considered part of the field of complementary and alternative medicine.
Right.
And I love Michael Cohen's definition. He wrote Future Medicine. He's a wonderful academic and an attorney in this field, and a colleague that I've admired for many years. And he calls complementary alternative medicine, or CAM, a consensus term, meaning everything outside of Western medicine. Well, that's a huge group. I mean, it's nutrition, and it's energy healing, and it's somatic work. I mean, and indigenous cultures, there's just so much in there. But energy healing and biofield practices would be considered a subset within the whole field of complementary and alternative medicine. So in that CAM field, there are some practitioners that are licensed in all 50 states, and that would be chiropractors.
Right.
They're the only current CAM practitioner that's licensed in all 50 states. And they had a long haul to get there. They were being thrown in jail for practicing medicine without a license before they were able to come together and get licensed in order to practice. Then there's some that are licensed in some states and some and not in others. So let's talk about that. Would be massage therapist. That would be nutritionists or dietitians. That would be acupuncturists and naturopathic physicians. So they're licensed in some states, but not in others. Then the next group would be those that are completely unregulated. And in that group is all the energy healing practitioners and practices that we are aware of, completely unregulated. And so the only exception to that is that there are some states that require you, if you're an energy healing practitioner that uses any kind of touch, you have to be a licensed massage therapist in order to practice.
Right.
So the reason why the government, the various states, right now, as a general rule, energy healing practitioners is a completely unregulated field.
Right.
There is no licensing. There is no certification from a government agency. And so what's happening is that as this field is wanting to move forward and to become more professional and more integrated into the healthcare system so they can offer their services, the government is really looking at the fact that it's completely unregulated. There's no way to establish standards at this time. There's a lot of people, and you've had experiences, I've had experience with unethical practitioners that have harmed. And so there's a myth out there, well, these are all safe and non-invasive, and that is utterly untrue and incorrect. That's a total myth.
So there are
people that,
Right. Go ahead. I'm sorry.
Well, there's just, there's lots of people that have been harmed by energy healing practitioners who have done things unethically. And there's a whole list that we could go through, but I'm not going to go into them today. So there is a real push and a momentum by the government, by individual states, to start to regulate the practice of energy healing methods.
And that's Massachusetts,
Massachusetts has a law right now that's pending. So this is kind of what's happening. And there's a lot of misinformation out there in the field. So if you're
Mm.
an energy healing practitioner listening today, then I would certainly encourage you to take a look at my book. I think you'd find it as a great resource. But also, it's important to be aware of what's happening from a sort of a legislative, regulatory
Mhm.
methods and
Mhm.
approaches that are happening.
Mhm.
Because I
Mhm.
think that we are definitely moving towards a place where we're going to start to regulate these practices.
Oh, that's cool. I think that's great. And regulating means extreme training and
Mhm.
certification programs and information
Yes.
like that so people can know who they're meeting with or who, and then there is that little fine line of people who may not be licensed or, regulated in any way, and yet they advertise as such. And some patients, it's the placebo effect. They think, oh my gosh, I feel so much better after having that Reiki treatment or whatever. It's like amazing. And then, other people say, I didn't feel a thing,
Yeah. Yeah. There's a
So
lot of
there's that.
issues around that. And
Sure.
I think first of all, if you're not licensed, you never have treatments. Because if you have
Right.
treatments, then the perception is you're offering some kind of licensed healthcare services.
Right.
So you
Right.
also never have patients. Patients,
Sure.
another word that means that you're offering licensed healthcare services. But I
Right.
think where there gets to be things get really wobbly with energy healing practitioners. If someone says they have a great session, like let's say have a great Reiki
Right.
session,
Right.
well, if that practitioner takes that projection from that client, they have totally disempowered the client.
Oh boy.
You know about the power differential in therapeutic relationships, right? You're a
Yes,
psychologist.
absolutely.
So what happens
Mm.
is they accept that projection. So it's more ego based. Instead of turning around and saying, "Oh, I'm so glad that you had such a good experience.
Right.
It was you're the one that did the work. I was happy to facilitate. I was happy to witness, but don't take on that projection
Right.
because then what happens is that client comes in for
Excuse me.
another session and
Yeah.
maybe they don't feel good because
Mm.
you can feel nauseous, you can have feel anxious, there's lots of different things that can happen that might be perceived as negative in an energy healing session. So if
Right.
you don't disclose that and a client has, like, maybe they detox something all of a sudden, could be something physical or emotional, and they don't feel very well, they're not going to be very happy, especially if you haven't
Right.
disclosed that. But what happens is then all of a sudden that practitioner's been on the pedestal and then all of a sudden they're not anymore, and the client is unhappy. And
Right.
so that's when clients are unhappy, they don't fully understand what it is you're offering because you don't have a really good sound legal
Right.
client
Right.
agreement for services. That's when clients get unhappy, that's when clients sue.
Sure.
So
Exactly.
that's what can
And
happen.
folks don't want that. Oh
Right.
boy. Yeah, thank you for sharing that with great information. So just to that's wonderful. To name a few here, Michael Cohen's book is and studies are great because I was reading about some of the energy medicine practices. So he's got mind body, yoga, prayer, mental healing, energy modalities. See, I wouldn't think yoga was classified as an energy healing practice, but I guess it is. Because people tend to look at yoga, of course, yes, it's mental, it's energy, it's healing, but a lot of the yoga that I've taken is more about stretching the muscles and balance
Right, right,
coordination. So
right.
there's kind of a fine line there, but so there's the bioelectromagnetic that people use, or biofeedback systems,
Hmm.
things like that. Pharmaceutical, biological treatments, herbs. That's a huge business, right?
Oh
Isn't that
yeah, yeah.
incredible? My gosh. Also, herbals, as I mentioned, treatments focusing on diet and nutrients,
Hmm.
which who knows about that. And like you said, tapping. And we talked about what do you think about EMDR, the eye movement desensitization therapy that people. Do you think that's more of a psychological, or is that
It's
it's like
really been focused mainly. My understanding is that EMDR can only be taught, or you can only be certified in EMDR if you're a licensed mental health
right,
care professional.
right,
Is my understanding. So I really kind of put it into the category
sure,
of a psychotherapy intervention or psychotherapy technique or method. And I know people have really good results from that. I think there's been some studies. I think
Right.
it's kind of been more accepted into the psychological community. It's still not a traditional
Sure.
psychotherapy
Right.
treatment, but I've heard really good things about it, and I think there's other modalities that have kind of looked at that bilateral stimulation and
Sure.
things like that,
Sure.
and have incorporated some of those methods or philosophies into other types of techniques that they offer as well.
Great. Thank you so much. That is so helpful. By the way, in case you just tuned in here, you're on the couch. And here's my special guest with me, Mitch Murphy. All right. Look at this book. It is amazing. You might want to check it out also if you plan on becoming a healing practitioner in any way of different modalities that you would like to be trained in, and or if you are already an energy healer, this is the book to get, because it will also help you understand some of the legal blocks that you might run into, to understand what it means to be legal and ethically sound. And of course, you also have information to help them attest that they should take, perhaps. Can you talk a little bit more about that?
Well, I think it's one thing to read a book. Doesn't mean anything, really.
Right.
The only way to demonstrate you have any kind of understanding or competency in a subject matter is to take a test.
Yep.
So I created this test based on the book, and it's I think it's I've always get great reviews when people take the test. Some people go, "Oh, I had to take this test because I'm getting certified, blah, blah." And they come back and say, "Oh my gosh, this was the most amazing thing. I learned so much and I was so excited about it." And so that's very heartwarming for me because this is my
Sure.
path of service. But
Sure.
I think what it does do is it that certificate of completion, as I mentioned, is a professional credential. And this is so critical these days. I mean, let's talk a little bit about what if you are wanting to become an energy healing practitioner? You're
Right.
interested. What should you be doing?
Right.
Well, you really need, first of all, what kind of particular technique or method or approach really resonates with you, and because there's so many different ones out there. And then you have to really take a look at what kind of training is available. And I
Right.
think it's very important to make sure that you have, if you're interested in putting some money down
Yeah.
and getting trained, that you
Yeah.
go with a legitimate professional
Right.
certification program. And
Right.
there are not that many out there. There are some. And some of the things you should be looking for if you're wanting to become trained is that
Mhm.
you need to be actually trained in this method and learn
Yes.
this method. And that doesn't
Right.
happen over a weekend.
Right.
There are people that
Exactly.
say, "You come take this weekend workshop and we'll certify you." That's totally bogus. It's
Right.
completely
Right.
unethical. So you want to make sure that you get trained. And
Yes.
sometimes beautifully, if you can, now that we can come back together again, if you can do it in person, it's great. Sometimes there's some training that can be quite effective if it's done online. And then the other piece is
Mhm.
then, okay, then you have to practice. You have to have
Yes.
take some
Yes.
time to integrate this, what you're learning, and then you
Right.
have to have
Right.
a certain number of practice clients you need to work with, and you have to be supervised and mentored through this process.
Right.
So
Right. Exactly.
it's not just 5 clients, practice clients. I mean, you have to have enough so that you have a broad range of situations,
Sure.
and then
Sure.
you should document those so that your program director can look
Hmm.
at your case studies or the session notes and get an understanding about how it is that you're working with clients, and they can guide you
Yes.
and help you to make sure you're doing a good job. The other key component is someone has to observe you
Sure.
actually doing an
Right.
in-person
Right.
session with a
Right.
practice client. And that can be done online, or you can videotape it and the program director can view it and watch it, because you have no idea what it is you're doing until someone can really mentor you and how to actually work with someone one on one.
Yes.
Without that piece, you do not have a legitimate training program. The
Right.
other piece
Right.
is you want to actually experience that energy healing method yourself. So I would say you hook up or connect with someone who's certified and trained in the method, who's offering this service to mentor you so you experience
Yes.
the method as a client yourself. To me,
Right.
that's critical, and it
Right.
doesn't
It
have to be
is.
many, maybe 5 or
Yes.
6,
Yes.
because you are going to be a much better practitioner to the extent you've
Right.
done your own healing work,
Exactly.
and so
Exactly.
this is really important. And then the other
That's
piece
a
is
great
to make
idea.
sure
Mhm.
is you get this training. You read the book and
Yeah.
you get the certificate of completion in ethics. So
Mhm.
those would be the components that I say are essential for someone
Yeah.
who is interested in becoming an energy healing practitioner.
Oh, what great advice, Midge. By the way, in case you just tuned in here, you're on the couch, and my special guest, Midge Murphy. Her book is really amazing, and it's wonderful for individuals who would love to find out about how to protect themselves legally if they become energy healers, and or if they are considering going into the field, and or if you are considering seeing an energy healer, how to really find out if someone is legit
Yeah.
and is really good at what they do,
Yeah.
and can ethically, legally back up their own business. You know,
Yes.
talking about people and situations that might be inappropriate. I love the scenarios you give, by the way. Yeah, Midge gives these scenarios about people who got in with energy healers, and there was some legal issues that went on. And I love scenario number 2 because I have a friend who's given me permission to talk about this. She is a certified Reiki healer for 20 years. Amazing. I mean, she is just brilliant. And she does have an energy that is like no other. So even if you walk into the room with this person, she's amazing. But anyway, it's about a young man who goes in to see his massage therapist. All right. He does energy balancing techniques. Let's just say his name's Mark. So you give that example. And Steve is the patient. He's a very stressed out real estate guy. You know, he goes in there and he balances his energy and gets massages from this Mark gentleman. And then all of a sudden, during kind of a session, deep state of relaxation, Steve starts sort of feeling really uncomfortable stuff about his childhood, seeing how his mother beat his father, she explained here in the book, and he starts feeling really odd and uncomfortable. He doesn't really want to talk about it because but he still enjoys those massage therapy sessions. But he doesn't come back. He stops coming back because he just starts canceling those appointments to avoid further pain. So to your point, Midge, about professionals who have been doing something for a long time, you have to be really careful about the possibility of someone having unresolved subconscious issues or things that are coming up for them, perhaps because of the relaxed state that they're in, or they may be a little vulnerable. So this is something that I guess the massage therapist specialist Mark has to turn or suggest Steve or turn him over, refer him to a licensed psychologist or psychiatrist or MFT or something like that, right?
Yeah, I think it's really important to know what it is your legally defined scope of practice. And I think with these energy healing methods, you might start out like I just want to feel better about public speaking, or I want to not be so anxious when I take an exam. Those are things that are not subject to some kind of licensed healthcare
Right.
services. A good life coach can help people with those kinds of
Right.
issues.
Sure.
They have a goal, they want to accomplish something. But then sometimes, especially with
Yes.
some of these methods, such as the
Sure.
tapping, is that it can, because the body keeps score, Bessel
Yeah.
van der Kolk's work on trauma, is that yes, things
Yep.
can come up out of the
Right.
subconscious through the body that weren't expected. And so when
Mhm.
that's why the practitioner needs to be extremely aware of what is happening to the client, and to
Right.
make sure that
Right.
they're being safe and that they're being protected in terms of what's going on in the
Mm.
session. And so if something like that kind of comes up, then you need to be aware of how do you help the client self-regulate so
Mhm.
that they're safe, they
Yes.
actually leave the session. But extremely important to have a referral network that you can refer people to if you feel like, something came up, Dan, today in the session. It seems like you were really upset, and there might be a deeper psychological issue that
Yeah.
I
Yeah.
really can't help you with, but I would
Sure.
love to refer you to someone who can.
Sure.
And then once they're referred to the psychologist or the psychotherapist, then sometimes it's great you can work as a team.
Right.
But it's important to refer them to because it's really about what it is that they need.
Right.
It's not about you.
Exactly.
It's about, that's
Yes.
how you have a client-centered
Hmm.
practice. One of the
Right.
foundational pieces of
Yeah.
of having an ethical practice. So I think
Yes.
it's really important. I think also I'd like to mention, if you are tapping practitioners out there, I have wonderful colleagues, Craig Weiner and Suzanne Fagel, who offer a tapping out of trauma course.
Oh,
And if you're a
wonderful.
tapping practitioner, it absolutely at some point in your practice, someone is going to have an adverse reaction. And so this particular course actually helps you deal with, as a practitioner, how do you really help someone, a client who inadvertently gets
Yes.
triggered, and how do
Yes.
you really help them? And so you
Right.
don't get that training when you normally go through an EFT tapping certification program. And so I
Uh-huh.
love this. It's more of a continuing education course, but
Yeah.
I highly recommend that course to any of you that are EFT tapping practitioners. It really
Oh,
helps you learn how to deal with that and take better care of your clients.
oh, what a great idea. And that what you call tapping out of trauma? Is that
Yeah,
what? Uh-huh.
it's
Okay.
EFT Tapping Training Institute, and it's Craig
Okay.
Weiner, yeah, and
Great.
Alina
Thank you
Frank.
for
They
that.
work together, yeah.
Great. That's so great that you can recommend someone who you really trust and know what they're doing, and they can help train people as well. Yeah, there's the late great Dolores Cannon. I don't know, you've heard of Dolores Cannon, right?
Mhm.
She's one of the foremost, I guess, in the Jose Silva method of hypnotherapy.
Okay.
She's a licensed hypnotherapist, and she did it for 45 years. But she regressed people to go back to
Mhm.
early traumas from their childhood. And she learned through her methods, she was really terrific, to calm people down.
Mhm.
And if it got too traumatic or somebody was in that hypno trance or whatever, that they would start yelling or experiencing the trauma all over again, she would know how to calm them down and gently bring them out because, but my point to all this is she, from early on, had a very I want to say ironclad disclosure statement, a legal statement about this is completely, here's what you could experience. And this is what has been proven in the past. This is the method I use, etc.
Mhm.
So she was really amazing and had herself really safely protected, legally, and ended up writing 20 books on it. So
Yeah, that's great.
yeah.
She was quite a pioneer, yeah.
Aw, I love her. What patients rather might not be appropriate for energy healing? I know that in your book you suggest that there are some folks that just they might not do well in certain energy healing practices.
Yeah, I write about that extensively. I don't want to go into all the details, but basically sort of you want people that are grounded, that can self-regulate, that are curious and open to learning. What you want to stay away from is people that seem especially needy, that are very dependent, that expect you to fix them or heal them, that are not sort of they're not. I call them like they're little space cadets. That's
Right.
not an official term, but you
Right.
want somebody who's not
Yeah.
kind of really scattered. Their energies are not
Right.
super scattered. Um,
Right.
because they're just kind of all over the place energetically. So they may not be a good candidate for energy healing work.
Yes.
And because it can really change your worldview in a huge way that may not be easy to integrate into your life at times.
Right.
Especially, for example, you might do some energy work and all of a sudden you have a unit of consciousness experience.
Yes.
And that sort of experience of being one with the universe doesn't fit with some other sections of our society, especially some of the religions
Ooh,
out there. And so if you're in a community in which that's their
sure.
viewpoint and you have this other
Sure.
experience, and
Right.
so how do you navigate and how do you maneuver through? And so it can cause a lot of dissonance in your life at
Oh
times.
boy.
So you have
Yes.
to be really careful about, you know, how you can incorporate what happens to you and what kind of shifts
Right.
and things and growth that you have when you do energy healing, that are more maybe on a spiritual level than on a physical or emotional or mental level. And so
Yeah.
again, you have to be kind of just mindful about that and to make sure that it can be a big upheaval at times.
Yes.
Not
Yeah.
common, but it can happen. And
No,
so just
yeah.
to be aware of that and to really help guide your client through that process.
Well, that's great advice. Yeah, you talk. I was just reading about that in your book about, inner child work and guided imagery and how that can result in a spontaneous shift in consciousness. Sometimes not in a good way, So it's very confusing, like you said, disorienting. You feel disassociated from your body sometimes, or odd, or you come out feeling odd. And I find this commonly happening in folks who have, I guess we call it emotional dysregulation, to where mood swings are happening frequently. Let's just say even before any kinds of treatments, daily mood swings. From crying and verbalizing anger, 3 hours later, and then loving everyone, and these kinds of shifts. Like you said, someone who's a little more grounded and not so emotionally dysregulated.
Yeah,
So
definitely.
And again, if they're going through trauma, and which has caused the dysregulation, to really explore a licensed psychologist or LMFT or licensed social work who specializes in patients, who works with patients like this.
Exactly.
So what are some of the myths about practicing energy healing methods? You talk about a little bit about those in your book.
Yeah, well, there's this is a big one. There's this myth out there that you need a license to touch.
What?
and that's really not. And the answer is, well, it depends. It depends on what type is the type of touch that you're using with your clients subject to licensure. And as I mentioned, at this point, the only ones that are currently subject to regulation are those certain states that require you to be a licensed massage therapy to do any kind of touch, energy work touch on someone. Now, there's some licensing boards, massage licensing boards, who actually have exempted energy healing methods from being subject to licensure. Oregon is one of them. At least that's what's on the books right now. And sometimes you have to look a little bit deeper. So there's a number of states, if you read the Massage Practice Act, they'll say if you do this kind of work, energy work that influences or has to do with the human energy system, there's different kinds of words they use. Sometimes they'll mention a specific modality like healing touch or Reiki, sometimes not, is that they say then you can go ahead and practice. You do not have to be a licensed massage therapist. So that is one of the myths out there. That you have to have a license to touch. Another myth is, oh, I'll be just fine if I get ordained on the internet.
Oh, dear.
Yeah, oh, dear is right. Yeah, oh, dear is right. So they think, well, first of all, they think, okay, if I'm ordained on the internet, that means I can offer counseling. Spiritual counseling to people, or pastoral counseling to people. I can touch people. And that's a complete and utter myth. First of all, that credential is completely bogus and would never be recognized or accepted by any regulatory agency, by any licensing board, or by any court of law. So I would say that I know you can get ordained over the internet to do ceremonies. Okay, that's fine. But when you're offering a healthcare service, that's not going to cut it. Okay, it's not going to protect you, and that's a complete and utter myth. And so these other people think that, well, I'm doing spiritual counseling. Counseling, that's a real triggered word, because the perception is you're offering some kind of psychotherapy with counseling.
It sure is.
And so other people say, well, I'm doing pastoral counseling. Well, and there are a lot of the Psychology Practice Acts specifically exempt what they call pastoral counseling. Just like with the Massage Practice Act, they exempt some kinds of energy healing practices. Well, if you look at the statutes, it's very clear. You have to be part of a recognized church. You have to be trained. You have some kind of a degree in divinity or theology or whatever, that you're a recognized pastor or reverend or priest in your church, and you are offering pastoral counseling to the congregation, to the participants, or whatever you want to call them, that belong to your church. Then you can offer counseling, pastoral counseling, and you're not going to be charged with practicing psychotherapy without a license. That doesn't mean you can go out and hang up a shingle and say, okay, come on in here and let's do some pastoral counseling. Yeah, so that's a really big myth. Yeah. And the other myth that I mentioned earlier is this myth that these practices are completely safe and non-invasive and no one ever gets hurt. That's a
Right.
complete and utter myth. And so those are some of
Wow.
the basic ones that I like to point out about the myths out there.
Sure.
And there's another myth
Sure.
now that says, well, I'm going to get thrown in jail if I get caught,
Yeah.
as an unlicensed practitioner. Well, no, you're not going to get thrown in jail, but you could get a cease and desist letter. And another thing is like, these licensing boards aren't out to get you. They're just
Right.
trying to protect the safety and welfare of the citizens.
That's right.
So that's
Yeah.
where people need to understand that these licensing laws that for all licensed healthcare services, the
Right.
underlying regulatory value is the protection and safety of the citizens. And
Mhm.
that right comes from the 10th Amendment to the United States Constitution, granting states the right to
Yes.
protect their citizens. And
Yes.
so
Yes.
this is the way that we have set up our healthcare system,
Right.
is we require licensure, because that at least indicates that the practitioner has some level of competency. And
Yes.
we know not everyone is competent. There are problems with some licensed practitioners as well.
Sure.
But by and large, the system works pretty well
Sure.
in terms of making sure that they've gone through their training, they've gone to school, they've gotten advanced degrees, they've had hundreds of hours of supervision or residency, they've taken all their ethics and legal exams and all of that before they can go out and actually and
Right.
pass their boards, right?
Sure.
And then they get licensed. And
Yes.
so I think that this is the way the system has been set up. And again, it may seem onerous, it may seem not fair, it's not a level playing field, all of that. But the bottom line is it's about the safety and protection of the people that we serve.
Absolutely. And becoming certified and having more knowledge about your field as well, and really having to study and really understand what it's all about is really essential, in helping you be a better practitioner.
Yep. Yeah.
In general, it'll help folks. Speaking about, problems and safety and all that, what titles are legally, problematic that people have sometimes
Oh
as
boy, there's some
energy
good
healers?
ones. Yeah,
Yeah.
there's some good ones out there.
Yeah.
Um, and I talk a lot about titles in my book.
Yeah.
And give, safe titles and titles you
Right.
want to avoid.
Sure.
So I think what people need to understand is that in a lot of the licensing practice acts for the various healthcare fields, there are things called restricted titles.
Right.
And for instance, in the practice of psychology, if you look at psychology practice acts, very clearly they say only licensed psychologists can use the word, and they give a whole slew of words. Can say psychotherapy, psychological,
Right.
psychology. So, for instance, there was someone in a state in the South who was not licensed, who called herself an energy psychology practitioner.
Okay.
And so she got a cease and desist letter from her board saying you are in
Sure.
violation of law because you're using the
Sure.
word psychology in your title.
Right.
I mean,
Yeah.
that's just a slam dunk. And so she was
Sure.
actually in violation of all 50 psychology practice acts in all 50 states by using the word psychology in her title, or even using the
Yes.
word
Yes.
psychological. The other things you want to avoid is using the word psychotherapy. Now, the other thing you want to avoid is the word therapy. So you don't want to say you do therapy. You don't want to say you're a therapist, an energy therapist,
Right.
because the perception
Sure.
is if you're saying you're a therapist, the perception is
Right.
you're offering licensed healthcare services. So, you have to be very careful with doctor, because
Yes.
some states
Yes.
only medical,
Absolutely.
and if you have a
Right.
PhD, that's fine,
Right.
but you have to disclose and make sure it's very clear. It can be very misleading. I mean, I've had energy healing practitioners that say, I'm Dr. So-and-so. And so they
Right.
think, oh, well, they're a physician or something.
No.
And they have
Right.
a PhD in chemistry. Okay.
Right.
So
Exactly.
it's about, it can be misleading if you don't use the credentials correctly. And so,
Absolutely.
yeah, so
Mhm.
those are the kinds of titles you want to avoid. And again, I list
Mm.
a lot of them in the book. And, the word practitioner is very neutral. The word
Yes.
coach is very neutral.
Yes.
So I ended up calling myself an energy healing practitioner, but then I have disclosures of what does that mean? And I make it very clear
Right.
that I do not offer
Yes.
any kind of, Western medicine. I don't diagnose or treat medical
Right.
conditions or psychological disorders. I'm working with the
Right.
energy field of the body, blah, blah, blah. So that putting the body in balance, unblocking and making the
Right.
flow of energy. So it allows the body to heal itself.
Yes.
So that's what's critical about
Absolutely.
energy healing methods. It's like
Yeah.
we're just we're helping the body to come back into homeostasis,
Yes.
and that
That's
we know the
beautifully
body.
said.
And the
Right.
body seeks to heal itself. So
Yes.
when the flow of the energy is blocked or not in harmony, and we have these methods that can help regulate and get the flow of the
Yes.
energies in the body moving properly,
Right.
then the body will naturally heal itself.
Yes. Beautifully said. Beautifully said. Well, Midge, we're just about out of time, but I want to make sure people can really find out where's the best way that they can find out more about you, get your book. Here we are, folks, and really understand what you're talking about a little bit more. Practice energy healing and integrity, the joy of offering your gifts legally and ethically. What's the best way?
Well, the book, the print book that you have there, can be purchased on Amazon. And also the Kindle version can be purchased directly on Amazon.
Great.
The exam and some of the other things that I offer are only available on my website, which is really simple. It's midgemurphy.com. And so
Okay.
the PDF version of the book is also available on my website. And I have some
Great.
free blog articles that people might be interested in on specific subjects about what website disclaimers, scope of practice issues, HIPAA issues with regards to
yeah.
having an energy healing practice. So those are all free. And so people are
That's
more than welcome
wonderful.
to take advantage of those. And then I also have
Mm.
information about my training organization revenue sharing program also on my
Oh,
website.
wonderful.
Yeah,
Oh, that's
so people,
great
if you're,
information too.
yeah.
Midge Murphy, thank you so much for being on the show. Lots of information to digest. And of course, y'all can see the rerun of this show. If you'd like, come on back to LA Talk Radio on my webpage, and you can watch and listen all over again if you'd like.
Well,
Thanks
thank
for
you,
being
Michelle.
here. Oh, it's a
You're
pleasure
welcome.
meeting
Thank
you.
You too. Thanks so much
I
for having me.
appreciate. Oh, absolutely. I appreciate all your knowledge and everything you
Thank
have
you.
to offer. Take care.
Thank you.
All right, everybody. Thanks for listening today. And I'll be back next week with another great guest to talk more about owning your own spirituality, understanding who you are, and how you can calm your anxiety and depression as well. Thanks for joining me. Bye.
You're listening to On the Couch with Dr. Michelle, right here on LA Talk Radio.